Hi, I'm Dr. Masha Livhits, an endocrine surgeon at UCLA Health. Today, I want to talk about who is eligible for Thyroid Radiofrequency Ablation, or RFA, a newer, minimally invasive option for treating certain thyroid nodules. If you've been told you have a thyroid nodule, and especially if it's benign but causing symptoms, you may wonder if RFA is an option for you. Let's start with the basics. What is RFA, and why should someone have it? RFA is a treatment where we use heat delivered through a thin needle under ultrasound guidance to shrink a thyroid nodule without surgery. There are no stitches, no general anesthesia, and no hospital stay. You go home the same day, and recovery is usually very quick. But RFA is not for everyone, so who is a good candidate? The ideal patient for RFA is someone with a large benign thyroid nodule that is causing noticeable symptoms. These symptoms might include a visible lump in the neck, a sensation of pressure or tightness, difficulty swallowing, discomfort when lying down, feeling like the nodule is getting in the way of daily life. In these cases, RFA can shrink the nodule significantly over time, typically by about 50 to 80%, relieving symptoms and improving appearance, without needing to remove part of the thyroid gland. Now, it's important to note that not all thyroid nodules need treatment. Many are small, stable, and don't cause any problems. If your nodule is under 2 centimeters and not growing, we usually just monitor it with periodic ultrasound. RFA is really meant for nodules that are larger, symptomatic, and benign. And that brings me to another key point. We require 2 benign biopsies, called FNAs, before offering RFA. We want to be absolutely sure that the nodule is not cancer because RFA is not currently being used to treat thyroid cancer or nodules that are suspicious for cancer. That's why we require 2 separate fine needle aspiration biopsies with benign results. If there's any uncertainty, we will likely recommend surgery instead. Sometimes patients ask, why not just remove the whole nodule with surgery? Surgery is still a great option for many people, especially if we're concerned about cancer or if there are multiple nodules. But RFA gives us an alternative for people who don't want surgery, who want to avoid a scar or want to preserve as much of their thyroid function as possible. It's also a good option if you've already had thyroid surgery and want to avoid another operation. So to summarize, you might be a good candidate for RFA if you have a benign thyroid nodule confirmed by 2 separate biopsies, a nodule that is causing compressive symptoms such as pressure, a visible lump, or difficulty swallowing. You're looking for a non-surgical option with a quick recovery. RFA is not recommended if the nodule is suspicious for cancer, you have not had at least 2 benign biopsies, or the nodule is small and asymptomatic. At UCLA Health, we offer in-office consultations and ultrasound, and we'll walk you through all the options, whether that's RFA, surgery, or continued monitoring. Our goal is to create a treatment plan that fits your nodule and your preferences. If you'd like to see if you're eligible for RFA, schedule a consultation with us on our website or give us a call. We'd love to help. Thanks for watching. I'm Dr. Masha Livhits. Take care, and we'll see you soon.